For those not as familiar with Zoom, you want to go to the toolbar, and there is a little microphone there, and underneath the microphone it says mute, and if you push that, then you're set. It should be on the left-hand side of the bar. Okay. All right. So thanks all for being here and for being part of this wonderful organization that I just became a part of too. And what I'd like to talk about today is just the healthcare consequences, and just really taking it from my perspective. I know all of you have very unique and important perspectives when it comes to taking care of clients and approaching people who have been through stress and domestic violence and crises. And so this is just my way of saying, you know, this other aspect is here and such an important part. And I feel very passionately that it's not talked about enough. And it's quite a long and extensive amount of information, but I'm trying to make it as valuable to you as possible. So a little bit more about me. So I'm a physician at Bronson. I'm at Battle Creek. I'm a doctor of osteopathy, and my specialty is physical medicine and rehabilitation. So that specialty is very broad. It is basically the general medicine of pain and disability. We're the people who run rehab hospitals after someone has a stroke or an amputation. And then in the outpatient world, we do a lot of the chronic pain and pain management. And so I was brought on at Bronson as a back pain specialist. And because there's such a need in Battle Creek, I've kind of expanded into a little bit more general rehab. So I see some strokes, some spinal cord injury, and I've been seeing a lot more of the fibromyalgia population and chronic pain population. So I would say at least 10% of my population, we actually do get into all of these home stressors. And as all of you know, how prevalent intimate partner violence is and domestic violence is, I deal with that on a regular daily basis, just from the pain perspective, from the people coming to me for help for their medical reasons. And then there's all of this underlying, all of these underlying issues there that actually cause a lot of their pain and haven't really been addressed that way. So I'm a volunteer at S.A.F.E. I deal with clients all day at work, and I'm very happy that at S.A.F.E. right now, I'm mainly in the storage room trying to tidy up, and that's what I'm doing there. So feel free to say hi or write notes to me of how you want things organized down there. And I just want to start with where my professional interest in this topic came from. And it really started in medical school from the professional standpoint, and share a story of three women. So these are stock images, but there are three women in medical school that I was taking care of as a medical student. And I did an extra year in medical school teaching the osteopathic manipulation course, which is a hands-on therapy that doctors give. It's very similar to chiropractic and massage. And I did an extra year where I had my own clinic that was supervised, and I just took care of people every other week in this clinic in this half day. And these three women kept coming back over and over the course of 2 years while I was at this clinic. And all of them were really similar. They were all in abusive relationships to different degrees, some more emotional, some physical, and then it really depended on the day. And all of them had multiple health conditions: heart disease, gastrointestinal disease, chronic pain, hormonal issues. Every single one of them was on over 10 medications or supplements, and all of them saw at least 3 specialists within the medical field. So they were constantly worried about their health and constantly in pain and in trouble, physiologically, physically, health-wise. And then when they came for this therapy, we were mainly dealing with their muscle pain, their back pain, and we were doing very gentle touch. We were very cautious about positioning to make sure that they felt comfortable. They always had a beeline to the door if they needed it. And they kept coming back because they kept saying that it helped. They said that it helped their pain. It was very good, but their pain never went away. Their pain never went to zero. It was actually a little bit dissatisfying as a student because I was like, I'm going to fix people. I was like, this is not about fixing people. This is about maintenance. And all the pain came back in 1 to 2 weeks. And they would talk about their problems at home sometimes, but not necessarily. It wasn't a required thing. There was no specific counseling involved. But if they wanted to talk about it, then you provide listening, validation, and say, oh, and does this hurt? And just talk about their body and why they were there. And then one of the patients, after almost 2 years of treating her and seeing her very regularly with the help of a local domestic violence organization, and this was in West Virginia at the time, she left her husband successfully, safely. And after the treatment, after that happened, for the first time after the treatment, her pain went to zero. It was nothing for the first time in her body. And she had terrible back pain, neck pain, migraines, and then follow-up treatment because we were like, okay, we just need to check. And over the next 2 months, she didn't need any additional treatment because she had no pain. It actually stuck, it actually kept. And in 6 months, she was needing half the medications she was previously on. She was a new person in a lot of ways. And the main difference is that she felt safe and she had less stress. But I was left saying, why? There's just this incredible connection between our stress levels and our everything mental in our life. But this was above and beyond what I thought was possible. I mean, how can you stop having blood pressure issues? How can you stop having irritable bowel syndrome? How can you stop having terrible hot flashes by changing your surroundings? So some objectives and things that I'm going to talk about. And again, I'm just going to highlight some of these things because they're incredibly in-depth topics, but just touch on some barriers to adequate medical care and how our environment affects our health. Just understand how our body and mind are completely and totally inseparable. Actually, the idea of mind-body connection just also doesn't sit well with me because the fact that you have to say there's a connection means that they are separate in some way. We're just stuck with that language. And review how our bodies chemically react to stress. So we're going to get a little bit of a neuroanatomy lesson here. Understand how central sensitization works and ways to integrate our body into the healing process. So barriers for patients are a lot of the barriers that all of you face as well with patients as well. Lack of trust, lack of safety, feeling of guilt, previous bad experiences, isolations from their abuser, and just a history of marginalization of women, and in particular women of color. And there's lots of studies around this that are asking women and men about why they aren't seeking care. And all of these things do play a role and have come up. And one of them is just mandatory reporting, not knowing what that means. And so I appreciate the advocates being here and helping with that part. And just feelings of being listened to in safety and not necessarily knowing how the healthcare system works, because there are some good parts of it, and then there are some very difficult parts of it that are really awful to navigate. So barriers from my perspective, from the healthcare perspective in working with these patients, I'm going to kind of skip to the last bullet, is they're really difficult patients to treat. And just as sometimes they can be difficult clients in a lot of ways, in the medical setting, they are very difficult. When I say I work with fibromyalgia, to a lot of my other colleagues, they want to give me a gift. It's like, oh, you need help, you need a piece of candy. I can't deal with this group of patients because they are incredibly difficult. It's a challenging group because it's chronic, and there is so much complexity to them that the time that you give is always going to be inadequate. So you're kind of just climbing uphill, and that's really hard to do all day long. Other things is just lack of training. There's been some studies that say, almost all of medical students get some level of training in domestic violence and abuse. But one study, by the end of their medical school, one group said that only 35% of students thought it would be relevant in their own practice. So yeah, they get training in a lot of things, but it just goes right out the window when there's a lot of other things on board. As far as continuing medical education in Michigan, we have a lot of work that we need to do every year, about 50 hours of training every single year. And there's 1 hour of ethics that's required. Great, 1 hour of ethics every 3 years. We need 3 hours of pain management every 3 years. And at least once while working in Michigan, you need to have a 1 hour training in human trafficking. And that's pretty much it. Everything else can be whatever type of education you want and seek out. So there's no re-upping this. So the outreach that you guys do in the community really does matter because there's not enough training. Family medicine physicians in particular reported feeling underprepared, and they have a tough time because a lot of times if they are taking care of a victim, they are also providing for the perpetrator. And without any training for that, it's really easy to want to avoid the whole situation because they just don't know how. And then the other part is, it's like, okay, you have training, you think it's important, and then we start screening. Awesome, this is great. But then there's also some studies that say, great, you can identify someone who needs help, but it doesn't actually increase the number of survivors referred to specialist agencies, which is kind of terrifying because then you pretty much put the client in a position where they had to expose themselves as being this person, and yet they actually don't get any help, just furthering the distrust in the system. And so making sure that Safe Place and others like it are as available and noticeable in the community. It's not just for clients, but anyone who could be an advocate for them within the community. And the screening is laughable, and there's screening that's necessary, and it's checked on through safety protocols, and it happens for over 80%, up to 100% of cases where screening occurs, which sounds great, but the only screening that's necessary is, do you feel safe at home? which is absolutely not adequate to actually elucidate some genuine thoughts and feelings from someone. And I think even just saying, do you feel safe at home? And the second question is, do you feel supported at home? Just one little addition could help change the conversation. Of course, screening from a study standpoint really matters, and then you can get into have you had bruises from someone else? Have you been bitten? You know, going into all of the other type of screening questions. But do you feel safe at home as just not enough. So we just ignore this. Healthcare costs a lot. We talk about healthcare costs in terms of what these things can make the organization. And I am constantly, every single month, I'm told how much I made the organization, which I think is a little unethical, but that's the world that we live in. And the healthcare costs that I found when I was searching for this online is just really laughable. It's all over the place. And the basic is that there's no study that has extensively looked at the indirect medical costs of this issue. If you kind of break down other things that they've looked at, so intimate partner violence, but only for physical assault back in 2003 was an estimated 7 billion cost per year. But that's just medical care and mental care immediately after. Rape and sexual assault, average in 2008, 32 to 148 billion per year. But that's only in medical, mental, lost earnings, and criminal justice, not long-term. And then childhood victimization and being around that, they only said 55 billion per year, which is also not correct and doesn't make any sense to me, because all of these, I think, are gross underestimates when we kind of take into effect everything else that happens and everything else that we see. Another issue, and actually it was one of my patients, he had been through childhood traumas, and I was talking to him about this, and he was like, oh, Occam's razor. And I'm like, wait, I haven't heard that one for a while. What is that? And he was placed into a category of being a psychogenic case for everything that he was going through. And Occam's razor usually makes sense. It's saying the simplest explanation is usually the right one. Don't look for zebras, don't look for anything else. If you're looking at something that looks like a horse in Michigan, it's probably a horse, okay? And when you take a look at these pictures, I mean, what do you see? I mean, we like to categorize people. We need to categorize people. So the first one you see, okay, someone with substance abuse, and they look a little crazy, and they probably have some personality disorder or something like that. The second one is obviously addicted to nicotine, has had a really hard life, scars on his face, maybe gets into trouble, maybe has aggression issues. The last one just seems kind of odd, and also maybe personality, maybe some depression, anxiety, over the top type of personality. So when medical personnel see this, just like everyone else ever, you categorize and try and keep it simple in order to go quickly, find a simple solution, try and make things better. But really, as my patient reminded me, the truth is actually Hickham's dictum. And he was a physician who knew all about Occam's razor and thought that the medical community was using it too much, and said, no, in medicine, Occam's razor never works because, quote, a man can have as many diseases as he damn well pleases. So it's really the counter argument to say that it's a complex system and problems have more than one cause. And it's because we are incredibly complicated and complex creatures. The mind and body are inseparable. And when patients come in and they say, oh, the other doctor said it's all in my head. I was categorized as a personality disorder. I have bipolar, I have depression, and the list goes on from there. And then I have this other issue of get heart palpitations, or have this other issue of, my back aches. I have this other issue of migraines. And trying to kind of say, actually, it is all together, I use several examples of this about how our outer environment affects our inner environment. So think about public speaking. So imagine all of you are up to this microphone and are about to just talk your heart out and tell a group of strangers an hour-long lecture or something like that. And what happens to your body? So the scenario is mental. The scenario is you have anxiety over something that you're about to do, but what happens physically? So physically, you get butterflies in your stomach if you're lucky. You start to sweat, your palms start to sweat. You might have to run to the bathroom if you're less lucky. Your heart feels like it's fluttering. You could feel nauseous. You could just start to sweat. Your face could get flushed. Your blood pressure goes up. Now, all of these things are very real manifestations of stress. And it doesn't just work one way. It's not just that we have stress and then our body feels it, but also it goes the other way too. So if you're stressed and your heart starts racing, what does that do to your stress? It actually increases it. So you actually have a feedback loop of worry that happens. So you're nauseous, you're not feeling well, and then, oh my gosh, you're not feeling well, and now you can't really cope with the fact that you're going to give this talk, and I can't really cope because I'm feeling this, and then it's getting worse. And so it's really this one network, this one complex network that we're feeling. Hopefully that didn't bring up any negative feelings for people. This next one is, and this next example is more traumatic as well, but it also responds differently with our system. So about how our outer environment affects our inner environment and vice versa. So in even more traumatic experiences, so public speaking can be the excessive amount that we experience, excessive if someone has agoraphobia or something like that. But something that is truly life-threatening is even worse. And I think we've all heard of topics where and situations where someone is so physically hurt, but is so physically full of adrenaline that they don't feel the pain, and they are pretty much out of their mind in a lot of ways. So getting up from a car accident with a broken leg and trying to run is one extreme, or to the other extreme of being in this situation and completely shutting down and not being able to really work or function. And there are certainly, if you are physically injured, it can affect your mind in that way. But also, if you are just worried about someone else, or worried about the vehicle, or worried about everything else, that can also shut down your body as well. So these are very extreme examples of this complex interaction. Those are acute events. Those are, in the moment, and people feel like generally it's not going to last. Eventually the talk will be over. Eventually I won't be at an accident scene. That is very well embedded in us. But when it comes to chronic stress, then we're looking at a lot of other changes in our body that isn't just for that moment. It's not just sweaty palms. It's not just feeling like you could lift up a car, and it's insidious. So long-term stress can affect your body, and it affects your body in not just acute ways, but chronic ways. So you're more likely to get a cold, more likely to gain weight, more likely to have diabetes, sexual problems, gastrointestinal problems. Your risk of heart attacks could increase. Skin diseases can increase, headaches, depression, all of these things from chronic stress and how it reacts with our body, and vice versa. So if you feel comfortable just sharing, or I can just share. So what happens to your body when you're stressed? And with this, people are very complex, and these answers change for everyone. And it really changes too if it's a minor temporary stress versus a major stress, or a chronic minor stress and a chronic major stress. And what's minor and major really depends on everyone too. So if anyone would like to share either your experience or working with clients, that would be great. So what kind of
insomnia is maybe one that wasn't on. I don't think I saw insomnia on there.
Yeah, absolutely. We'll talk about that too. Absolutely. Yeah. So that can happen with any stress for sure, depending on how sensitive someone is to it. Absolutely. Yeah.
Maybe poor decision making and judgment too.
Yep. Yeah. And when we think about poor decision making, I tend to think about more major stresses or chronic stresses in particular, because once one bad decision is made, it's really easy to cycle through more. At that point, I do that with ice cream, but there's certainly a lot of change that goes on with that.
What I think about is just the fact that if somebody's in crisis, the whole fight or flight instincts and how your judgment is based on more primitive kind of reactions.
Mm-hmm. Yeah, and so when we're thinking about that, we're thinking about mental a lot of times, and then what happens physiologically with that. So when our thinking is poor, there are chemical changes that are happening in the body, but what do we feel in our body that's different?
Rush of adrenaline.
Yeah. So anxiety we think of as a mental disorder, but anxiety is increased heart rate, also increased blood pressure. Its sensitivity to the skin can increase with all of these things too. So it's really a reflection of both. Thank you.
I know and I think numerous other staff, sorry, Hadley's talking in the background, get migraines when we're, especially like you said, if it's chronic or if it's something that's going on for a long time. That's usually when many of us identify we need to take a day, is when we get a migraine.
Yeah. And that's change of blood flow. That can be stress in the neck and tightness in those neck muscles that are causing a pull and a strain. Change in posture as well. When we're chronically stressed, changes as well. So we hold our head differently, and biomechanically we move differently when that happens. Chronic stress also means that our other coping mechanisms are down. We might not be exercising or eating right, which also changes our chemistry in our joints and our muscles as well. So yeah, great. And beautiful segue here, Heather. So the autonomic nervous system is certainly a huge part and given a lot of blame in this in these issues. So the classic example that's given in medical school, and I'll say why this doesn't make sense but the classic example is being confronted by a lion. And what do you do when you're confronted by something that can kill you and eat you? And a lot of different things happen with this. So the sympathetic nervous system starts in the brain and it goes into the body, and it increases your heart rate, increases your breathing rate. Your blood is rerouted to vital survival organs. So blood is increased in your brain and in your heart and your skeletal muscles, and decreased in your gut in particular, and decreased in your skin. So things that aren't needed right now. You have all the nutrition that you can take right now. This is an emergency. This is what's happening now. You have a state of hypervigilance. Your pupils dilate. And you might see this with clients as well who are in acute crises. Their pupils are actually more dilated than they would be otherwise. And I don't like the idea of being confronted by a lion because I've never had that happen. So it's a little bit different. So I kind of have two examples of that I give to people depending on who they are. And one of them is the idea of crossing a road and a car is coming at you and just trying to get out of the way. Like, you need to get out of the way. There is something coming at you right now. You need to jump, you need to go, you need to brace yourself if you can't get out of the way, that automatic response. And the other one that I give, and this one actually, unfortunately, gives some people anxiety, but then we kind of calm down afterward, is if they have children and it's kind of like you're in a crowd with your young child, and you're starting to lose them in the crowd, and like you just can't stay connected, and like that feeling of like just trying to fix it, trying to make it better, and that state of hypervigilance that so many people have gone through and experienced. And I've seen people, as I say this, that you need to get to them. They start getting nervous and breathy, and like we're calming down, we're good. But that's actually that experience kind of cues them in and saying, oh yeah, that does happen to me on a regular basis, even when it's not someone else in danger, even when I'm not in immediate danger, that feeling that something is wrong. And it's not just here. It's throughout your whole body. You can feel it, you can see it. The parasympathetic nervous system is the rest and digest. And so when you are in overdrive in sympathetic, you have terrible insomnia, and you're not able to process food very well. Both, it's hard to get the nutrition that you need out of food, and also the gut can move faster or slower, mainly slower than is needed.
On a totally random note, that is like the most stunning picture for some reason to me. I literally had to screenshot it and keep it because I'm just so drawn to that picture. Am I like really weird right now? It's just so beautiful. Okay, so Danny's agreeing with me. Okay, thanks, Danny. I'm not a nut job.
Yeah. So yeah, it doesn't look that scary right now. It looks very nice. So there's another system that we can't leave off as either, and that's the hypothalamic pituitary adrenal axis system. And the basic of this is it creates cortisol, which is our primary stress hormone. So the autonomic nervous system works in our nerves and goes out our nerves and tells the organs what to do. Whereas this system is hormonal, and hormones circulate through our blood and last longer. So they can still rise pretty quickly, like adrenaline, they can still rise pretty quickly. But this is something that gradually goes away over time. The nervous system is quick. This one is the slow mover. And cortisol, everyone needs cortisol. To live, you need cortisol. It is an important part of our daily living to keep us going. It regulates so much. It regulates our sleep-wake cycles, regulates our blood pressure, and we need blood pressure in order to live. So it helps regulate our sugars, and we need sugars in order to live. So this doesn't just do bad stuff, it does really, really good, important things. But it's also labeled as the primary stress hormone because when it's high, it means that everything needs to be ready to go. And it's one of the reasons why steroids and cortisone, when someone is in the hospital and fighting off a terrible illness like COVID, one of the things that they give in addition is cortisone. It's this cortisol, it's this stress hormone to really work on this response and building up the response in our system to danger, to imminent threats and danger. So it's a really, really important thing that we have and that we need. But when it's in overdrive constantly or underdrive constantly, and with chronic stress, it can be both. It can be an overdrive when it shouldn't be, and an underdrive when it shouldn't be. And so that can really change our health. And so one of the interesting studies that I saw on this was with children in New Orleans, and they were living within they looked at the density of liquor stores, domestic violence, and violent crime in their neighborhood. So if they lived within 500 meters of a high density or rate of these things, the children showed decreased telomere length, which increases the risk of disease like cancer and shortens lifespan. And the kids were exposed to a stress scenario, a reactivity scenario in a laboratory setting. And they found that they reacted just like every other kid, but their cortisol levels couldn't decrease again like other kids. It stayed higher for much, much longer, dysregulating their sugars, increasing risk of obesity, diabetes, things like that. And then during their daytime, when they weren't exposed to anything, just daily life, they actually had lower than needed cortisol levels, which lower than needed means that they're at risk of getting infections. They're at risk of not responding appropriately or well enough to just daily life stresses. And this change, this up and down, they almost think is a biological shield. So they're not constantly up all the time. But in reality, going back and forth that way is also just really, really difficult. And this is not necessarily someone who is living with this situation. Just near the situation with children was enough to cause these changes. So stress effects. I like this picture. Just sometimes the most productive thing you can do is relax. And Americans are really terrible at this. just really awful. So additional stress effects, we've talked about some of these already: insomnia, poor digestion, heart disease, stroke, cancer, diabetes, obesity, poor healing, early death. It's wonderful. All right, everyone relax, no more stress. That's just not going to happen. And I think everyone who works with people like this have their own stresses, and seeing it put into perspective sometimes is also really important. It certainly is for me, just to see things in perspective, because we all are supposed to have some stress. That's why the cortisol system is there. That's why the sympathetic nervous system is there. That's how we live. But it's also just trying to find that balance where it's not affecting our health on a regular basis. So some things specific to the clients between violence and health. So abused women are 70% more likely to have heart disease, 80% more likely to have stroke, 60% more likely to have asthma. This is not just what we already know is that they're more likely to have depression and post-traumatic stress and anxiety and substance abuse. I mean, that's what we all see every day. But it's also true health problems. When they say that my chest hurts and they think it's anxiety, it usually is, but they are still more likely to have a heart attack than someone who is not going through what they're going through. So the idea that the healthcare community needs to take this very seriously every single time is, it just can't be understated from my perspective. They're also twice as likely to have fibromyalgia or chronic fatigue syndrome, which we'll talk about in a moment. The childhood victimization and domestic violence exposure is even worse. So almost 3 times to 5 times more likely to have health issues. So this is one of the reasons why the idea that it's only going to cost an extra $50,000 per childhood victim per year is just incredibly wrong in my mind, because these people really do rely on the healthcare apparatus because of everything else that goes on in their body from this exposure. And so kind of after everything we've talked about, I think I had admitted someone, there we go. After everything we talked about, what's actually going on with these people. And I think it's pretty clear that there is a lot of things going on health-wise, in addition to just, there's psychogenic issues here. There's way more issues here. There's liver disease, there's risk of lung cancer, there's poor diet, there's obesity. I mean, there's so many other aspects of this that need to be addressed and treated in the healthcare system. And there's just not enough resources or time in the day. I looked over at my chat, and Stacy asked if we know why human trafficking is the only required training on a specific victimization on victimization. And no, I have no idea. I think there was a push for human trafficking to be part of the training at one point, and it got through. And I think there's another requirement that is coming up through the legislature right now on, on more of marginalization and implicit bias. So I think there might be 1 hour of training that's starting on that soon. That's going to be required, but nothing else is required yet. So we shall see how that goes.
Thank you. Yeah, like I said, it's the same for counseling and social work. So I just wondered if, anybody knew of a specific reason. Um,
Yeah,
Hopefully they'll keep adding.
hopefully they'll keep adding, yes. So so the people who have their video up, if you could raise your hand if you've heard of fibromyalgia before. Yeah, some. All right. So do you know what fibromyalgia is? All right, good. So most patients don't. They have a decent idea, but for me, fibromyalgia is, I go through a 3-page diagnostic criteria with my patients, because the idea of giving this diagnosis to someone as oh, you have fibromyalgia, doesn't really help anyone except for insurance companies to, write a label and cash a check. With fibromyalgia, it is not yet a true disease the way that some other things are. So heart disease, it's very measurable. You can see it. You can measure it. With fibromyalgia, you can't see it. You can't measure it. There's a lot of thoughts as far as making that better. And doing more genetic testing and biopsies and trying to truly diagnose the pathophysiology of it. But in general, fibromyalgia is a description of someone's experience. And the idea of diagnosing someone with a description of their experience is really difficult. Just like it is kind of difficult to diagnose someone with bipolar disorder, to diagnose someone with depression. It really matters if the patient themselves also say, oh yeah, that matches with what I'm feeling. I do have depression. So the same thing is true with fibromyalgia. If they're just given the diagnosis and don't understand it and say, oh yeah, that does work for me, then it's a pretty worthless diagnosis. And for me, fibromyalgia is a central sensitization. What that means is there are multiple triggers in the body, but in addition to the sympathetic nervous system, in addition to the HPA axis, that gives widespread chronic pain and multiple other health conditions. And though these stresses don't cause fibromyalgia, any type of emotional or physical trauma may trigger symptoms in people who are susceptible, either through genetics or through luck. And so I kind of take it on a scale of, there are some people who can get shot in the leg or run on glass and keep going. And then there are some people who, can stub their toe and feel pain out to the tips of their hair for days. And we are all on this scale in some way, shape, or form. And it's really a matter of how far you go on that scale with your life experiences, the behavior that you were taught, and how you were told to deal with these things. The neuroanatomy of central sensitization is complex. Some of it is learned behavior and neuroplasticity. Neuroplasticity is just how our brain changes to process information over time, and that is measurable with MRI. And this is a quote that I liked: "The longer you have pain, the better your spinal cord gets at producing danger messages to the brain, even if there's no danger in the tissue." So this is even out of the head. This is not mental anymore. This is not, you thinking through that process. This is truly that animalistic part of what's going on. And the body also has automatic PTSD-like feedback loops. They keep us safe, but can be tricked. And if chronically used, they can overestimate your danger. So this little study done in someone's backyard they have a fake hand and your real hand, and you touch the fake hand and you touch the real hand while you're looking at the fake hand. And it tricks your brain into thinking that that hand is real. And this happens very quickly in a lot of people. And it's just that pain perception can be tricked. It is not always related to physical injury. So he's slammed. Huh?
I'm sorry to interrupt you. Is this somehow related to that? If somebody has like their leg amputated, that they can still feel?
Yes. Yes, it can be. So actually, it's the opposite way. So when someone loses a limb, their brain still craves the information from that limb. And so the brain ends up making up information for that limb, which tends to be pain a lot of times, or the odd positioning of the limb is still there. And so the treatment for it is actually something very similar to this, is mirror therapy, where they see their leg as a reflection of their good leg. And they do therapy on the good leg while looking to, and seeing that it's their actual missing leg. So visually, they get the stimulus that their brain craves that says, oh, the leg is there, it's fine, it's being touched. And so that perception, that trick is actually used as a therapeutic mechanism in amputees. And for this, coping skills really, really matter to differentiate between what is real and what is a perceived threat in the body. So that difference of light touch to damaging, bruising touch, sometimes it's hard to differentiate what's coming at you. And so light touch becomes painful because you expect that light touch to be bruising touch. You expect it to be violent touch. And so that's another way that it can be tricked in a negative way. More neuroanatomy, and this is the amygdala, which is our base fear threats response in our body. It takes us and teaches us that the car driving your way is a threat. It tells you, it's the processing center that gives you the reminder of what is a threat and what is not a threat. It increases sensitization and readiness. It downregulates it mainly imbalances your cortisol response, and it downregulates your prefrontal cortex. So when your amygdala is in high gear, when your threat level is in high gear, and this can be chronic as well, not just, spur of the moment. This can be chronic amygdala in crisis. Your prefrontal cortex can't work. Your other systems are taking over. So judgment is worse, higher level of thinking is worse. Memory can also be worse. It can also affect your hippocampus. And that counseling, education, desensitization can allow that therapeutic pause in the amygdala's response. So when you need to jump away from the moving car, you don't want to think about, oh, I wonder if the driver's texting or not. No, you're not going to be thinking any of those thoughts. You're not going to be thinking, has this happened to you before? You're just going to jump. And that's a good thing for the amygdala. But in overdrive, then we have all of these other issues as well. And the amygdala also interacts extremely tightly with our emotional aspect of pain and pain perception. So we don't just feel touch on our body, we also feel touch emotionally. It's also embedded, whether touch is good or bad, in the amygdala when there's fear or threat, even if there's no physical assault. So even the threat of physical assault can be embedded in our pain and pain perception. So increased body pain in general can increase the amygdala's response, decrease higher level of thinking, and just unbalance our homeostatic mechanisms. And a calmer and happier body can do the opposite. Outside of the brain, there's a couple other mechanisms, and I'm going to go through these really, really quickly. The dorsal root reflex is, we think about sensation as we touch. It's giving a signal of, oh, that's touch, that's right there. But if it's a painful stimulus, a cut or something like that, it doesn't just go up, but also you want to heal the cut. So those nerves also send down inflammation and irritation in that area to help heal the cut. You know, you're trying to fix it. So what that does is it causes some swelling, causes some irritation, it might cause some itching, and then you feel more discomfort. And the body's like, oh, I still need to fix that. I need to send down more inflammation. And it has this good feedback loop. But in people who have this extra response, that feedback loop can get very messy to the point where you actually don't have any damage anymore. There's no cut left. Everything has been healed, but you still have pain there. You still have irritation there. It still swells. And that is outside of this realm of thinking. This is just embedded in our body, and it can go haywire, especially when this milieu of negative hormones and overdrive are in place. And this is one of the reasons why if we hurt something, like hurt our back, for example, and we might hurt a spot in our back, we tore a little bit of a muscle, a little bit of a ligament, we tore a little bit of a disc, there's a little bit of a slip disc, there's a tiny bit of arthritis, you know, that everyone gets at some point in their life. And then that pain gets worse. And it doesn't just get worse here, it gets worse here, across your back, across that area where the nerve sends signals of, oh, I need to fix something. Oh, it's still painful. Oh, I need to fix something again. And so pain can kind of blossom from this, this reaction. Again, PTSD outside of the brain is we have additional cells that tell our nerves how excited to be. And these glial cells, these support cells that are in our brain and our spinal cord, can be primed to make things worse. And usually it's a good response, you know, when we're in a really awful situation and we need to know if there's a threat, we need to know what's happening, we need to be extra sensitive in our sensation to prevent pain, illness, and death. These really react and help us out, but they can be overstimulated, and it primes us to, when there's another stimulus, something else negative happens, you feel it even more. And this is actually one of the reasons why chronic opioid use is so terrifying, because chronically, opioids on their own chemically increase glial cell sensitization. It increases the amount of pain you feel when you have another stimulus. So the idea when someone says, oh yeah, I'm on opioids because I can deal with a lot of pain, it's like, actually chemically you can't. Actually chemically, if two people with kind of the same baseline genetics, and one of them's on chronic opioids and one of them is not, and both of them receive the same pinprick of something, the one with opioid use, chronic opioid use, is actually going to feel it more because their body is primed to feel it more. And then they get into the cycle of, well, I just take more pain meds. You know, there's that problem with this. And sometimes I bring this up with patients as well, that sensitization could save your life. And it's a way to bring it back because it's really easy to hate our bodies. No matter what we're going through, it's extremely easy to hate our bodies and feel like we're being betrayed by something that should be stable and should be okay. And this study, you know, we would never do something like this in humans, but we kind of see it all the time. This study took injured squid, poor little squid, and they sensitized one group to pain. and kind of caused all of these mechanisms to happen. And the other group, they blocked the pain. And then they threw all of these squid in with a sea bass, their predator. And as expected, the group who were sensitized, the group who could feel pain, the group who could react, survived. So the idea of someone in crisis, they can't get through this, their body is betraying them, it is actually trying to help. And sometimes just hearing that in a different way can be helpful as far as body image goes. I just want to be an optimist and want to say that our body wants to do the right thing. All of these mechanisms are here to help us survive. And most likely, if they are in a crisis situation, it actually has helped them survive. They might not be living very well, but they are alive. And these mechanisms have really helped them push through in a lot of different ways. So stress and injury create pain, but it also protects from further injury. It's natural and common reaction in animals, and it does relate to humans in a lot of ways. So saying that, in the lesser degree, your tight muscle, it's awful, it's terrible, and saying, oh gosh, that muscle, especially the one up here, that's a weight of the world muscle. It must be really protecting you from a lot of your stresses during your day and trying to get you through. And just saying that is just that connection and saying, your body's not trying to be evil. Your body doesn't hate you. Your body's trying to do the right thing and just can't right now. And it's stuck in a loop that's negative, but it's okay because that's how it's supposed to behave, because that's how we survive. Let's see, I want to check my time. Okay, I think we're good. So ways forward. One of the things that I do with a lot of people, especially when I'm talking about back pain, is have them actually say thank you, sometimes out loud, when I'm starting treatment. As I'm going through their muscles and I'm like, ow, that must hurt. Oh, that's tight. Oh, goodness. And especially if we've talked about their life or stresses and things like that, I have them kind of focus on an area that hurts. And instead of saying, ow, I hate it, I'm like, it must be doing something for you. Otherwise it wouldn't be there. So I want you to, if they don't feel comfortable with me touching, I have them touch and take a really deep breath and say, oh, thank you. Just something very simple. Just say thank you, because it actually, it's not necessarily trying to be negative. No, that's the one way, the one thing that I say where I separate the mind and the body, because I don't think the body hates us. I think it's just trying to survive. And then practice caring for the body. And this is a practice. No one's good at it. This is a constant thing. So one thing is talking to a healthcare professional and really making sure symptoms aren't something more serious, because it can be serious, especially when we're under chronic stress over and over. Those body the body manifestations of what's going wrong, can't be fixed by us stopping having stress. They are embedded in us, and there's other ways to treat it besides saying, okay, if I'm just less stressed, like that's just not going to happen. We have so many other things that we need to be stressed about in order to not just live, but also be happy. And strive for other things. And then there's self-care, comforting touch and movement. One of the things that I just hear a lot of, and I wish I could tell every patient that I see, and maybe you could add this to your milieu as well. Just ways to get doctors to listen. And I wish I didn't have to say this, because I think doctors should know better, but we don't, and I don't, on a pretty daily basis of how to approach things and making sure that I'm doing right by everyone in a very confined amount of time. And so this is a phrase that I think every patient going through trauma should know when talking to their doctor. So one is acknowledging that stress affects your body. So just doing that, just saying, oh, I recognize that there is this connection. I know that stress can do terrible things to my body. It shows ownership, it shows insight, it shows willingness to communicate, which are things that if someone doesn't show when they go to the doctor takes less time with them. This has been shown, this has been proven. These patients are really difficult to treat, and they're more difficult to treat if they don't have any of those three things. So that small phrase does a lot. And then the next part is, but I'm worried that something else is also making me feel this way. Again, it's recognizing that there's a possibility that this is it, but what else could there be? And that triggers multiple things in doctors: willingness to help, compassion, but also legal worries of what am I missing? And triggers the doctor to say, okay, they recognize they have stress. This could be related to the stress, but oh my gosh, is there something else? They know their body, they're telling me something important. So this phrase, I think, works wonders. The last part is just for them to go prepared, to make a list of their concerns, and helps everyone make use of a short amount of time, and makes them triggered to maybe get a sooner appointment to talk about more things as they go. As far as self-care, there's lots of different ways to have self-care. Sometimes it's going to the doctor, sometimes it's stopping bad things, sometimes it's going out and doing self-care, manicures and spas and hair done and things like that. What we typically think about as of healthy lifestyle is diet and exercise, but there's so much more to self-care that can be very personal. And so, when I was doing a lot of testing, I would paint my nails before every test. And so when I was at the test and I was very stressed, I could look at my nails and be like, oh, I cared for me just for a moment. So everyone has that little thing. And it's one of the reasons why I kind of love the fact that in the storeroom at Safe Place, there's just a lot of health, of just lotions and makeup and nail things. And, it's not just the essentials of food and tampons, it's actually some things that are part of this self-care milieu that we actually do need in order to be happy and healthy. This gets us its own slide for sure. And sleep is really, really difficult for everyone at some point in time. This is not a unique thing, but it's something that I always ask patients about, because it's something that can be treated, which is helpful as far as trying to tackle something, but also saying that, oh, you didn't sleep last night? You have wonderful coping skills. You live with chronic pain, you live with an abuser, you have to do mental backflips to just wake up every morning, to get out of bed, to take care of your kid. Like, your coping skills we like to say people have bad coping skills a lot of times, but if they're in that situation and they're getting out of bed and they're feeding their kid or they're going to work, or like, their coping skills are actually pretty phenomenal in a lot of ways that I think are underappreciated. But then I'm like, oh, but you didn't sleep. Like, even the best people, even the best copers, when they don't sleep, it's really hard to cope then. It's really hard when you don't sleep, when you have pain, when you're dealing with all of these other things here. You've been doing this for years. That's pretty amazing. That's pretty incredible. But maybe if we help you sleep, you could be even better. Maybe if we help, your blood pressure not feel so high, maybe we can make you feel better. And so kind of taking it from the approach of positivity, and then what can we do to make you better, because you're already pretty practiced in a lot of these skills. Oh, this is a lot. So comforting touch. The beauty of comforting touch is you don't have to talk about it a lot of times. So you don't have to talk about your trauma with comforting touch. You don't have to relive things. You don't have to share things. And it can be alone or guided. So self-soothing touch. Had a client who the only thing on their body that didn't hurt were her hands. And so we started a program where she would just go finger to finger when she was feeling anxious, and just doing self-soothing on the only place that she didn't have pain. And then we worked her up to doing full hand touches, just slightly moving her arms, and then kind of working up. And now she can do self-soothing, including on her back, which is the worst. And she has this ritual that she does. It helps calm her down. It's helped her sleep more. And it's something that is self-applied. So she doesn't need someone else to do this. She actually has control, which has been a beautiful thing. Biofeedback, that picture at the bottom is really intense biofeedback, and that is available some places. But biofeedback can be something as simple as taking deep breaths and actually thinking through it. So these meditative practices of breathing and feeling it, slowing your breathing down every few counts can be helpful. Acupressure as well is something that can help. One of the best ones that I found is up here at the top of your forehead. And I don't know if it's true. I was told this in one of my acupuncture courses that I'm learning about, but the idea that your prefrontal cortex is right here. So, you have a high amygdala response that's breaking your prefrontal cortex. So you go here and you think, okay, all right, no amygdala. I want my prefrontal cortex. And I want my thinking. I want my higher level thinking there. I want it to work. I want it to feel better. And it's not just the touch, but it's the intention behind that. And when I give people that, I actually go through some of the neuroanatomy of why, to say, hey, your brain is in high gear, and it makes sense that you have brain fog. Absolutely, this is part of your survival mechanisms. So when you have that, think about here. I want you to touch, because that's the part of your brain you want to stimulate. That's what you want to think through and think about. It's not just this response. It's something else. It's something beyond it. When it comes to comforting touch applied by another, it really depends on the person and how willing or available they are to open themselves up like that. So Reiki is a non-touch touch. And, there have been times even in my life where, I really don't want to get undressed, but next to someone like that, I just, I don't feel comfortable. So that the idea that, oh, you just need massage, you just need, hugs. It's like sometimes you just can't be touched by someone else. So that's why, self-soothing techniques are so incredibly important. So movement, this is a combination, so movement and touch. So movement that's therapeutic and mindful can be incredibly helpful in a lot of ways. So bilateral stimulation is one. I don't do it quite as much now because so many people have shoulder pain and this kind of curls their shoulders in a little bit, but it can certainly be helpful and be part of counseling in general. And the idea is you can, with a counselor, you could actually do this and think through your trauma and talk about your trauma with the ability to bring it back to the now and feel some comfort and feel some safety. But this is also something that can be self-applied, and it's just gentle movement, gentle touch, and the combination of the two. EMDR and rapid eye movements is also used in counseling. And then movement, that the way that we classically consider it, the Tai Chi, Qigong, the yoga, cardio, cycling, boxing, running, everything that you can think of as far as movement goes to bring the body back into this. And yeah.
I'm so sorry, I keep interrupting you. Can you maybe say a little more about EMDR? I'd like to hear how that works. That's just quickly.
So I am not an expert. I don't use it. I mainly use the bilateral stimulation every now and then. Rapid eye movements is typically, or at least initially, used in therapeutic sessions with counselors and psychologists, where as they're going through a scenario or a trauma or just thinking about it, they're asking the patient to move their eyes, and it really breaks up the cycle and look in different places. And it really breaks up the cycle of what they're thinking and what their body is experiencing. And there's a whole, there's tons of different ways to approach this, and kind of the simplified version of how I understand it, which, someone who's an expert in this would probably disagree with me. But the idea of when someone's getting really worked up, and you've probably seen this with clients, they start itching and they start moving and they don't even know and realize that they're doing it. And so this is a ritualistic practice that puts their body within their own framework. So instead of doing this, say, I noticed that you're really moving, you're really fidgety, and that's totally okay, but can we take a moment and, do something with your hands and your arms that's more rhythmic, that feels a little bit better, that calms that area down. So these reflections of what's going on in their body and brain don't manifest in the same chaotic nature that we see it often. So it's really breaking it down and making it more rhythmic, making it more controllable, really. So I'm sure one of the counselors could tell you a lot more about it. But I apply it in very quick sessions when I see someone is so agitated that I need to stop talking. I need to completely stop talking. And it's like, I noticed that you're doing this, and we're here for your body and here for your pain. And I feel like I'm making more pain because we're talking about this. Can we just take a moment and do some of these exercises to kind of, tone it down a little bit? And that seems to help. The plus or minus for yoga is just because it's, and actually all of these is, sometimes being in crowds and being around people is really difficult. And yoga, the expectation of some of the moves is not very secure. Downward dog, if anyone knows yoga, is not a particularly comfortable position, especially if anyone has been through sexual assault or the threat of it. The idea that it's a one size fits all with this is just absolutely incorrect. And the best exercise is the one that they enjoy. So movement, can do all the opposite things that stress can do. It can help quit smoking, food cravings, improve sleep, improve mood, help PTSD, improve thinking, decrease disease, and live longer and healthier. And pretty much anything counts, and the Heart Association recommends a minimum of 150 up to 300 minutes of moderate to vigorous exercise per week. Moderate exercise means that you can't sing while doing it. So everyone's a little bit different with that. Now, if someone is not used to moving at all and they start moving, it doesn't take very much for them not to be able to sing while they do it, because their breathing has increased. But that's why, it's not a one size fits all. So that's moderate, you can't sing. With vigorous, you can't talk in full sentences. So those are the differences between the two. And 150 minutes broken up in any level of segment, in any space of, in any interval size works and counts. And I run into this a lot when movement hurts. So number one is ensure that movement is not causing injury. Women with pelvic pain, with headaches, not migraines, because it's a whole another matter, but ensure that the movement is not causing injury. And then you start slow, be persistent, be positive, and be forgiving. And so with that, I kind of break it down into green light, yellow light, red light movements. Green light movements, they might hurt, but they don't hurt later. And you can do these throughout your day. You need to live life. Yellow light movements are ones that do make you hurt later, but not hurt for very long. So these are things that, sometimes even for people washing the dishes, this is a yellow light movement. And the goal is to not stop doing some of these. It's about doing them regularly and slowly throughout your day to increase tolerance. Because the thing that happens with our minds in trauma is the same thing that happens to our bodies in trauma. As we get smaller, a lot of times our ability to go outside of the box that is keeping us safe gets smaller and smaller and smaller. And so the same thing happens with our body in pain. It can get smaller and smaller and smaller to the point where people are bedbound. And really can't do anything. And when that happens, the amount that it takes to get to that yellow light movement is much, much less. And then red light movements, obviously, these are ones that cause significant pain, but you can do them. If it's safe to move, if you're not causing additional injury, if pain is being caused by all of these other mechanisms of stress, you can do red light movements, but make it worthwhile. So that's why, with some of my fibromyalgia patients, I'm saying, going to that wedding is going to be a red light movement for you, but it's going to bring you so much joy. I support you going. And that really matters. I had a patient who really loved being a poll worker every year. She just loved it. It was a way for her to get out of the house. People loved that she did it. She felt supported by her community for it. She didn't really do anything else. And she was going to be on her feet all day for 12 hours straight. And she only does it once a year. And I'm just like, all right, go for it. But you need to do some yellow light movements to build up to it. But it brings you joy. Absolutely, go for it. So I know we had a lot of objectives, but these are the takeaways. So individuals and families served by Safe Place rarely receive healthcare support that they need and are at higher risk of diseases and illnesses. Nothing is ever just in your head. Hopefully everyone kind of walks away with that, if nothing else. And then the idea that we can improve our minds with our bodies. So, and thank you for listening. And thank you, Tina and Stacy, for helping me through this. And yeah. letting me be a volunteer. So thanks. Oh, I have a message. Oh, it's just a thank you from Danielle. So good. All right.
Sorry, I was waiting for a moment of quiet. Thank you. This was definitely different from what I think any of us, or I guess speaking for myself, from what I have heard. So this was really helpful. And I love the how to talk to your doctor. I think that that's definitely something I will use with clients for sure.